Hi, my name is Zach Demko. I'm one of the current first-year fellows at the Vanderbilt Child and Adolescent Psychiatry program. The other fellows and I wanted to put together this video to help answer some of the most frequently asked questions we get from applicants. We hope that it's helpful, and thanks for your interest in our program.
If I had to sum it up in a couple of words, I would say it's very friendly and community-oriented. You really do get the benefits of a strong academic center, but with that Southern charm as well, and a lot of compassionate people. The psychiatry department itself is very respected and appreciated by the other medical specialties, which certainly makes us feel valued in the system. Our department, the child and adolescent side, is extremely supportive. The training office really prioritizes the wellness and education of the fellows, and they really do take feedback into account. The faculty are great. They're so strong with their experience and their knowledge base, but they're very easy to access, and they're quite kind and great teachers. Overall, I would say that the environment is warm and supportive on all levels.
I wanted to tell you about the structure of CAP 1 year, which is a mix of inpatient, consults, partial hospital, and some outpatient. So there are 13 blocks in the year, and each block is 4 weeks long. We do around 6 blocks of inpatient work at VPH. We do around 3 blocks of consults. We do 1 block of our partial hospital program, which is here at VPH. 1 block of outpatient neurology, and 1 block of outpatient, which is a variety of settings: the Center of Excellence, developmental pediatrics, the eating disorders clinic, and neuropsychological testing. The remaining block is the holiday block, and that's usually a mix of inpatient and consult work, and runs from mid-December to mid-January. And we get 4 weeks of vacation, and one of those weeks will be either the week of Christmas or the week of New Year's.
The day starts out at 7:30, 7:45 when you arrive. We have a workstation up on the 8th floor, and what you'll do first thing is pre-chart, round on the census, which can be anywhere from like low teens to like low 20s. You'll meet with the other trainees on the service. At 8 o'clock, you'll roll the consult pager to yourself for one of the other trainees. We have our meeting with the whole team, so that'll include the attending. We're often going over the list and seeing what's been happening with our patients that we're following. This is also where we have dedicated teaching time up until 8:30 when we have our behavioral health huddle. That's when our child psychiatry consult team meets with the entire behavioral health service. And this is where we basically run through all the patients who's admitted for a primary psychiatric reason. After we're done running the list and figuring out who needs to be seen that day, because obviously we're not going to see the whole consult census every single day, we'll round in person as a team. This is when we can start getting new consults and trying to figure out who's going to see which new consult. We try to round as a team as much as possible for the follow-ups. I would say typically we're done rounding and seeing everyone we need to see by late morning. And so the rest of the day after that is mostly a split up of documentation, seeing new consults, and if you need to see a follow-up again, like seeing if a baby was still delirious. We quit taking consults at 5 p.m. After 4 though, we tend to triage like new consults and see if they actually need to be seen. Our goal is to not really have people there after 5 unnecessarily. So that's kind of like a typical day. Obviously, like on a consult service at a tertiary children's hospital, there's never going to be like a super typical day.
typical day on the inpatient unit starts between 7 and 7:30 when we show up to chart review on our patients and read up on any new admissions that came overnight to our team. Teams 1 and 2 both consist of a fellow and a resident as well as the attending. At 8 a.m., there's a bed meeting with all of the teams where we talk about anticipated discharges for the day and nursing staff brings up any other concerns from overnight. After that, the teams split up and we start to interview patients. Between 9 and 10, there's treatment team meetings where we talk about insurance coverage for the patients as well as if they've got their dispo plans in place, including if they've received placement at any residential facility or things like that. The remainder of the day is spent interviewing patients, conducting family meetings, and doing general inpatient practices. Day call is covered by either a fellow or a resident and is responsible for any new admissions that come to the child or adolescent unit up until 5 p.m., up to a maximum of 3 admissions. We also have a fantastic team of social workers that are with us on the unit who help us conduct the family meetings, interview the patients, and assist in arranging the next steps for them.
It's a little different between first and second year. As a first year, you have 8 weekends of call. You go in both Saturday and Sunday. And the requirements for those days are that you see up to 3 new consults if they come in before 11 a.m. So it's a maximum of 3. You don't always see that many. And as a first year, you're also asked to see the newly admitted patients on the inpatient unit. That usually ends up being like somewhere between 1 and 4 kids. And you also hold the pager for the home call for clinic. So you might get pages on the weekend for home call patients, and then you take home call for that full week as well. As a second year, you only have 5 weeks of call. You still have the same consult requirement, up to 3 new consults a day on Saturday and Sunday, but you don't have to see any of the patients on the inpatient unit. So it's a little lighter as a second year.
We have 1 half day a week of didactics. This is protected time, so you're not expected to do work from your rotation during that afternoon. And some people choose to roll their pagers to other members of their team. We get a wide variety of didactics taught by our child and adolescent faculty, as well as people in other specialties that are relevant to our education. So it's a really well-rounded and protected experience.
So our CAP 2 year is largely outpatient based. We have different various half days of clinic. Half of our time is devoted towards more commercial based insurance populations, and half of our time is based towards our TennCare or Medicaid population. In conjunction with having several half days of clinic where we're doing primarily medication management, we also have the opportunities to do psychotherapy with various patients in both of those populations, as well as several half days of elective time. I'm currently doing some research for pediatric delirium and devoting part of my outpatient time towards that. The other neat part of our curriculum in CAP 2 year is that we do get some exposure to outpatient ECT. We also get exposure to forensics. We also get exposure to developmental peds and autism as well.
I think it's a combination of things. So we get a lot of exposure to different kind of levels of care in different kind of areas of psychiatry that others may not get. So we are able to do ECT, we're able to craft different electives in the second year of the fellowship. The other thing that's really cool is, in addition to being able to mentor and teach medical students as well as trainees that are lower than us in year, we also get to partner with folks from Meharry, which is another psychiatry residency in the area. So we're able to supervise them, learn from them, and be able to kind of see a different perspective of kind of how they came to medicine and how they interact with patients and teams.
Favorite thing about the fellowship is the attitude of the division and training office. There's a lot of focus on like the fellows for sure.
To me, the best part of the fellowship is how supportive it is. My peers are wonderful and quite close-knit. The faculty are all amazing. They have so much experience and they really want to share it with us. And the training office is so supportive and kind. I can't imagine being at a more supportive program.
I'd say my favorite thing about the fellowship is the people. Both our co-fellows and also the attendings are great about helping you learn about what you're really interested in, and they're all really great teachers and very supportive.
My favorite thing about the fellowship is the people and the supportive environment we get to work in.
Definitely the people.
My favorite part of Nashville has definitely been all the surrounding nature and hiking that there is to do in the area. There's a ton of parks and beautiful mountains and waterfalls and all sorts of things that I've enjoyed exploring with my family since coming here.
My favorite thing about Nashville is that there's lots of good hiking trails and camping.
Probably the food. We have really great restaurants here.
I would say my favorite thing about Nashville is that there are like big city options without like big city stressors.
The music.
I think just having access to concerts or events that are just down the street.
For me, the best part of Nashville is that it's such a unique mix of things. No matter what you're interested in, there's something for you. Whether you're outdoorsy or musical, you're always going to find something to do and you'll never be bored.